8:24 right now. September is National Recovery Month, a time to celebrate those who have recovered from substance use disorder. And joining us this morning to discuss this and so much more is Jennifer Smith, the Secretary of Pennsylvania's Department of Drug and Alcohol Programs. Good morning. Thank you for joining us on Fox 43.
Good morning, Matt. Thank you for having me.
Yeah, and I do want to discuss National Recovery Month, which is obviously so important, and it comes after what I would imagine was one of the more difficult years of your career and your staff's career. What type of damage did the pandemic cause to substance abuse?
Yeah, that's a great question, and you're absolutely right. So we actually saw the peak of the opioid crisis in Pennsylvania back in 2017, where we lost about 5,400 Pennsylvanians that year. And then thanks to a lot of efforts at community, state, and federal level, we saw those numbers drop pretty significantly in 2018 and 19. But the COVID-19 pandemic really wreaked havoc for the substance use disorder community. And so in 2020, we saw the loss of just over 5,200 Pennsylvanians. So we're not quite where we were at the peak in 2017, but very, very close. And unfortunately, in 2021 thus far, it looks like we are on track to outpace last year, 2020.
And that's just from opioid use. What type of increase have you seen in terms of alcohol consumption over the last year and a half?
Sure. So yeah, we've seen certainly increased alcohol consumption, particularly among women. I think what's most concerning, Matt, about this is not just the number of individuals who have personally experienced that increased use, but how that impacts families and children that are associated with that individual as well. So the pandemic had so many effects on many, many people from a mental health perspective, from a financial perspective. And I think this is just one more contributing factor that we're really going to have to deal with for many years to come as we bring up this next generation of children.
And these are harrowing statistics that you talk about, 5,200 in deaths in 2020. But it's also important to set up National Recovery Month and its importance. How do you balance celebrating those who are trying and have achieved sobriety, while also recognizing that for many, they are still in the thick of this darkness right now?
Yeah, yesterday in particular was a difficult day. It was International Overdose Awareness Day. And so I spent my time yesterday with family members and friends who have lost loved ones and heard lots of names read and attended a candlelight vigil. And it is so important that we honor those names as people and not just statistics. And it's really ironic that that day falls on August 31st every year. So it's a day of really remembering and honoring those that we've lost, but then a wonderful transition the day that follows on September 1st to kick off National Recovery Month. And so you really start to see the flip side of that and celebrate some of the hope that comes with recovery.
It's a literal and symbolic turning of the page, and we're going to put some dates up on the screen right now that you guys are participating with National Recovery Month. There was a thing planned for today, which has been moved now to next week at the Raise Project in York, but these are events which are taking place all throughout the month across the capital region. Why is this so important to have these events?
It's so important to raise awareness about the disease itself and to really start addressing stigma across communities. I think the more we can normalize the way we talk about addiction or substance use disorder, the more it's going to help individuals and families reach out to seek the help that they need. And, truly, I believe that stigma is at the root of so many barriers to people receiving the services and resources that they need. So the more we talk about it, the more we raise awareness, and the more we send the message that recovery is absolutely possible if you reach out for that help. I really believe that we can make a change in what we're seeing these numbers being.
Jennifer Smith from Pennsylvania's Department of Drug and Alcohol Programs joining us this morning on the Fox 43 Capitol Beat. This is all happening at a time when the state's opioid disaster declaration had just ended. Without one in place now, what does the legislature, in your opinion, need to do moving forward to address this when they come back to session this month?
Yeah, I'll start by saying that we are fortunate that this crisis is a bipartisan issue. And so there is support for addressing addiction, both Republicans and Democrats. So that's a really, really positive thing. But I think what needs to happen is a continued urgency to continue addressing the crisis in communities. There's a lot of funding coming from the federal government, which is fantastic. And there's lots happening at the state level across different agencies and trying innovative approaches and building existing services. But really where we're going to make a difference is in our communities and making sure that we can get the resources that they need, whether that's money, whether that's technical assistance, whatever that looks like, making sure we get that in the hands of communities. And I think that's where our legislature can be really helpful to all of us in terms of communicating what the needs are in those communities and then supporting the implementation of those efforts.
And Jennifer Smith, Secretary of Pennsylvania's Drug and Alcohol Programs Department, thank you so much for joining us this morning. Try to stay dry today, stay indoors. We really appreciate it. Thank you.
Thank you, Matt.